Hi, my name is Sarah Ozuna, and this is my research communication presentation for Professor Winkler's class. During the COVID-19 pandemic, there has been lots of media attention on healthcare topics. Attention to the pandemic has both been negative and positive. Additionally, much of the media attention has focused on healthcare and healthcare employees. As potential exposure to COVID-19 has increased, so has the overall risks involved in healthcare. My research study aims to gauge how news media coverage is linked with job satisfaction of healthcare employees. Turnover rate for nursing staff can be particularly high, a staggering 8.8 to 37% depending on the hospital, according to Vaughan 2020. The COVID-19 pandemic has increased the stress on an already fragile system. With knowledge of how news media can affect perception of job satisfaction of healthcare workers, employers can enhance their communication campaigns aimed towards improving employee engagement and overall satisfaction. Information gathered from this type of research studies will allow employers to reduce turnover rate and costs associated with turnover. Literature review. Based on my investigation, there's very little research that has been done that relates to news media consumption and job satisfaction. There are previous studies that do focus on how news media can affect perception. For example, author Stephen Winter addresses the potential influence of social media comments on news media posts, specifically on Facebook. The author chose the heuristic model for theoretical framework for impression-motivated news consumption. However, this study does not relate to news media as a whole, nor does it relate to job satisfaction. Next, authors Ivan Serjan et al. Conducted a research study in Serbia to assess the impact of COVID-19 outbreak, related info and public trust in the health system, and preventative measures during the pandemic on levels of depression and anxiety. This study is relevant to my research as it deals directly with the perception of healthcare workers and how this affects their mental well-being. While my study focuses on job satisfaction, I believe job satisfaction is directly related to mental well-being when influenced by information about the COVID-19 outbreak. Third, authors Gauthier and Graciano examined the effects of negative news media of police and police brutality and the impact on public perception of the police. Results indicated that the news media does affect perception, but only if the news is perceived as fair. Additionally, the results implied that people who got their news from the internet sources were more likely to adopt negative perceptions of the police. These results justify the need for additional study on the topic of news media consumption and effect on public perception in general. In an article written by Zhang and Guo, titled A Battlefield for Public Opinion Struggle, How Does News Consumption from Different Sources on Social Media Influence Government Satisfaction in China? Researchers recognize that news media can influence public opinion and perception and seek to determine which sources have the most influence. A national survey of 2,882 Chinese adults concluded that citizens who consume news media from governmental sources on the country's major social media platform were positively associated with citizen perception of government. Exposure to alternative news sources had a negative impact on both central and local government satisfaction of citizens. This research is relevant to my study because results show that the source of the news consumption is just as important as the news consumption itself when it comes to influencing perceptions. As you can see, there is very little on my research topic specifically. Based on the current literature, we know that job satisfaction of employees is important to employers because it reduces turnover rate, which in the long run reduces overall costs. We also know that job satisfaction can be influenced by internal factors, meaning leadership abilities, as well as company ethics, employee empowerment, benefits, etc., all play a role in perceived job satisfaction. Current literature also suggests that perception can be heavily influenced by news media consumption, social media, and may also vary depending on the source of news media and social media. What we don't know is how heavily news media consumption can influence perception of job satisfaction. During the COVID-19 pandemic, news media has largely focused on healthcare topics. My research seeks to understand if there is a relationship between news, social media consumption of healthcare related topics, and job satisfaction of healthcare workers. Hypothesis. For my research study, I hypothesized that there is a relationship between news media consumption of healthcare related topics and job satisfaction of healthcare workers during the COVID-19 pandemic. Methods. To conduct my study, a survey of 13 questions was open to employees who worked in the healthcare facilities. The survey was open to people who work directly in patient care, such as nurses, radiology techs, nurse aides, etc. Survey was also open to those who did not work in direct patient care, such as laboratory staff, registration, management, and leadership. The study had a total of 29 respondents who were all healthcare employees in the greater Houston area. The opening portion of the survey requested and obtained basic demographical information, such as age, gender, education level, and whether or not the position involved direct patient care. Of 29 participants, 89.7% of respondents were female, 10.3% were male. The minimum age of respondents is 27 with a maximum of 65. Mean age of respondents is 39.97 years old. Standard deviation of 10.992. Education statistics showed that 13.8% had acquired technical certificate as their highest level of education. 27.6% of participants had a 2-year associate's degree. 51.7% had obtained a bachelor's degree, and only 6.9% of participants had a master's degree or higher. 89.7% of respondents held a position that involved direct patient care, while only 10.3% of respondents did not hold positions in direct patient care. 5-point Likert scales were used to measure job satisfaction, with the options of not satisfied, somewhat not satisfied, neutral, somewhat satisfied, and very satisfied. 37.9% were very satisfied. 44.8% were somewhat satisfied. 17.2% were neutral or indifferent. Respondents were also asked how they usually receive their news. To answer, participants were given an adjective checklist of available options and were told to select all that apply. Options available included traditional news, social media, newspaper, digital newspaper, podcasts, and others. And as you can see by the chart, 65.5% used traditional news, 55.2% used social media, 34.5% used digital newspapers or regular newspapers, 3.4% used podcasts, and 3.4% used other, and they specified it to be Newsmax. A frequency scale was used to measure how often respondents consume news media from various sources. 10.3% said a few times a month, 20.7% said rarely, 27.6% said daily, and 37.9% said a few times a week. And here is a table of the descriptive statistics. The study hypothesized that there is a relationship between news media consumption and job satisfaction of healthcare employees during the pandemic. Correlation tests were performed, and results indicate there is no relationship between news media consumption and job satisfaction of healthcare employees. The survey question, there has been negative media attention on healthcare during the pandemic, has a negative relationship to the survey question. To what extent do you feel news media coverage of healthcare has been positive or negative? The R value is negative 0.744 and the P's value of 0.000. Similarly, when participants were asked to what extent do you feel that negative media attention to healthcare has affected your overall job satisfaction as a dependent variable, and there has been negative media attention on healthcare during the pandemic as an independent variable, R equals 0.442 and a p-value of 0.016, which demonstrates a mildly significant correlation. Based on findings, if the participants' perception is that there has been negative media attention during the pandemic, then respondents also believe that negative media attention has affected their overall job satisfaction. Although the data did not fully support the original hypothesis that news media consumption has an effect on overall job satisfaction for healthcare workers, findings did support the notion that specifically negative news media attention and consumption can influence perception of overall job satisfaction. Discussion. With only 29 participants in the study, I feel the research study was significantly underpowered. The research would benefit greatly from a larger sample size that was spread across the country at various healthcare facilities and hospitals. I feel the small sample size of participants made the study overall weak and lacking in data. Additionally, I feel that the measures could be fine-tuned. Since the literature and results from this study suggest that negative media attention specifically can alter perceptions, then the survey questions need to focus more on negative news media attention of healthcare and healthcare topics. Theoretically, this type of data could be utilized for any employment field that may receive news media attention for various reasons, such as the police force, military, government employees, etc. More research is necessary to narrow the gap in the current literature on the relationship between news media consumption and job satisfaction. Thank you.